There is hollowness below my lower eyelid. What can I do? My upper eyelid is swollen, and there's hollowness below my lower eyelid. I'm just 26 years old, looking pretty old and tired. I've applied few creams, but I didn't get desired result. I'm getting adequate sleep also. Please suggest what to do. Thanks.
Thank you for your question. You're 26 years old and you're stating that your upper eyelids are puffy and that your lower eyelids look hollow and that you've tried creams without any success, and certainly you're trying to get some guidance as to what to do. Well, I can certainly assist you with this question with the photo you submitted. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. As far as the oculoplastic training is concerned, my background training before plastic surgery of the eyes was in eye surgery. So this training further was in advanced cosmetic and reconstructive surgery of the eyes, and eyelid surgery is a very big part of what I do, and helping people like yourself is something that is what our practice is about. So to begin with, let's start by just focusing in on the under eye area and the hollowness you're describing. What I notice in your photo is there is hollowness, but just above that there is puffiness. So I think that that without the benefit of a physical examination, I think we can say reasonably conclude that the puffiness is what's making the hollowness look deeper. I also explain to my patients that when they're concerned about hollowness, somebody often they look at the negative space and they don't realize that there is a mountain next to the valley. So the mountain or the puffiness under your eyes is what's making the valley, the hollowness, look deeper. Now there are a lot of reasons for this, but looking first at the puffiness, we have to have an understanding as why those under eye creams didn't help. And when you got those under eye creams, I'm sure a lot of them stated to help under eye puffiness. Well, the under eye puffiness is caused by something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes has pushed forward and created a bulge, and that bulge has pushed forward and is creating this look of puffiness and always looking tired. Now you may ask yourself, why at 26, which is relatively young, do you have this? Well, most of the time this is a genetic trait. So you may want to look in your family tree on both sides of your family to see who else has this issue. Anecdotally, I've operated on members of 3 generations in the same family because of this very strong genetic characteristic. The youngest patient we ever operated on was 14 years old, so you can understand that it can happen that young. In fact, many of our patients who are in their late 20s and early 30s will recount that they had this problem since they were in their teens. So that being said, what my approach to someone like yourself would be is to do something called a lower eyelid transconjunctival blepharoplasty. Now that mouthful of words means that what we're doing is we're approaching the fat pads from the inside of the eyelids. When you think of lower eyelid surgery, there's an external approach called a transcutaneous and then an internal approach called a transconjunctival. Well, since you're not likely to have extra skin, we would do this from the internal aspect of the eyelid. This way you avoid an external scar and we're able to approach the fat pads and sculpt them appropriately. This type of procedure has tremendous satisfaction amongst our patients. Getting rid of the bags under the eyes can literally be like a facelift. It can really just brighten up the whole face. The procedure in our practice is done routinely under local anesthesia with light intravenous sedation. It's performed in our office in Joint Commission certified facilities, which are basically hospital level facilities for safety and sterility, but performed in the convenience of our office. Local anesthesia with light sedation also allows to avoid general anesthesia. Now, this may be a big part of the solution, but you may benefit from other complementary type procedures such as the use of platelet-rich plasma and other ways to help improve skin quality. In terms of facial volume hollowness, that may be more of a genetic issue, but there are solutions for that. But it just depends on how aggressive you want to be. Again, I agree that I would state that for many of your contemporaries who come to us as patients, I try to minimize how many things we do for them. Usually, taking away the big negative is adequate. Now, for any reason this does not appear to be a family history or trait, and there is other medical issues that might be a factor, you may want to see an ophthalmologist or a medical eye physician to just make sure that there's no other signs of other thyroid-related issues, or have a medical doctor just make sure that there's no other complicating factors. People often will also concurrently have sinus problems and allergies. That's not 100% responsible for the fat prolapse, but certainly can contribute to the puffy appearance. So I would recommend you meet with qualified, experienced cosmetic surgeons, learn about your options, get comfortable with the way the procedure is done, look at before and after pictures that particular surgeon has performed, and once you're comfortable with the doctor, I think that moving forward you will at least unburden yourself of this dominant feature in the lower eyelid. So I think that with that being said, I hope that was helpful, and I wish you the best of luck. And thank you for your question.